advice and opinions expressed by Dr. Grandpichet and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
We're talking specifically about PDA and ODD. Ilana, do you want to ask the first question that was sent in by someone in South Africa?
Yes, absolutely. And we have so many parents whose children are being diagnosed with PDA, being pathological demand avoidance, and the ODD. And, parents just don't know where to turn. They don't know what treatments are going to be best. And we're just so happy to be having this conversation today. So my first question to Dr. Doreen is going to be, what is PDA and what are the criteria to be diagnosed with PDA?
Right. That's great. I'm happy to start there. And it would be good to just actually define PDA and ODD, right? So PDA stands for pathological demand avoidance. And let's just start right there, because PDA is not a diagnosis. It does not exist in any diagnostic manual. Let's be very, very clear about that. It is an opinion, okay? It's not a diagnosis. It has not been officially recognized by either the DSM, the Diagnostic Manual, or the International Classification of Disorders, the ICD. So therefore, it is not anywhere in the world a diagnosis. I apologize for repeating that multiple times, but I think it's really important, because we cannot just come up with concepts and then diagnose people with concepts that are not recognized as diagnoses. So let's just start right there. It is PDA, and we'll talk a little bit about ODD separately as well, which is oppositional defiant disorder, which is a diagnosis, and it is quite a different thing. But with PDA, it is so let's just talk a little bit about where PDA even came from, or where is this idea from? And this originated in the 1980s with a psychologist in England whose name was Elizabeth Newson. And she was describing individuals who did not quite fit the typical pattern of autism, because, and these were what she would refer to back in the 80s as higher functioning, very social, but manipulative individuals. So individuals who were using various social tactics to avoid demands that were placed or requests that were asked of them. Now, what is PDA? These are I don't want to even call them symptoms, because it's not a diagnosis, but these are the signs that have been described. And when I list these, please think about them outside of an individual with autism. Okay, just think about a person, anyone, ourselves, who might struggle with these things, or not even, like, these are just things. Listen to these signs. Avoid demands. Okay, so I feel like a lot of us avoid demands in certain places. Struggles to give up control. I feel like a lot of us struggle to give up control. Attempts to manipulate situations in order to maintain control. Okay. Uses distraction, negotiation, or defiance to avoid or escape situations that are difficult. Sounds like a very normal human response. Procrastinates and has very severe emotional reactions in order to avoid demands. That is it. Those are
This sounds like me doing my taxes.
That's what I was going to say. It sounds like anyone. And it's very important that you have to realize that when people talk about PDA, it isn't right now, because it's so it has been latched onto for the autism community, but it could describe anyone. It does not have to describe someone who already has a diagnosis of autism. It could describe anyone. And it is actually a very interesting description, because to some extent, and this, Shannon, you're going to love this, because this whole discussion today will have to do with fairness, right? Which is one of our favorite topics. So when you think about anyone in the world, given whatever skills they have or don't have, and you place demands on them, that are too difficult, for whatever reason, they are going to do all the things I just listed. They are going to try to evade, escape, avoid those demands. That's just a natural human reaction. And the way to get around that, obviously, is to make sure that the payoff for actually adhering to the demand, so the reinforcer, is big enough. It's fair. It's fair. We'll talk a lot about that in a minute. But first, I want to kind of differentiate real quick what ODD is, because that is a diagnosis, oppositional defiant disorder. It is a diagnosis. And it is based on symptoms, very specific symptoms that exist for a period of 6 months. These are how diagnoses in the DSM are measured. You have to have repetitive symptoms that are very clear. And the symptoms are the individual loses their temper multiple times in 6 months, is easily annoyed or angered, is resentful, is argumentative, is actively defiant, is deliberately likes to annoy others, blames others, is spiteful or vindictive. And these behaviors, 4 of these will have had to happen over the course of 6 months, and some of them at least twice. So there's a clearly defined set of behaviors. And remember, and again, you have mild, moderate, and severe with ODD. And ODD is often diagnosed with young children. And it is very controversial to diagnose ODD and autism together, because autism is a much more pervasive disorder and will cause some of these things, right? So you have it. You have one that is a diagnosis. You have one that's kind of a profile that has been described by people. Now, why is it all very confusing? Okay, let's talk about autism for a minute. So autism has all these symptoms we're very familiar with, right? And by the way, it's also very important to realize autism is this huge spectrum. So you have people on the higher end of the spectrum who have a hard time with social behavior, understanding maybe subtle social cues, etc., and then severely affected individuals who have a difficult time even communicating their needs, right? It's a huge spectrum. Regardless, life places demands on these individuals and they get frustrated. They have the inability to communicate their frustration often in a way we all do to some extent, right? There are circumstances where we all have a hard time expressing ourselves. And when that happens, they try to avoid the demands that are being placed on them. They may exhibit that avoidance in a very dramatic, emotional manner, just because they don't have language to better communicate. This is very frustrating for me. I don't really want to do this. I don't understand why you're asking me to do this. They don't have the ability to communicate those things. So therefore, they're going to scream, tantrum, hit, aggress. We've talked about this 1,000 times on these shows, right? Challenging behavior as a response is communication. It does not mean that I have some other profile that everyone has to tiptoe around. It just simply means I can't communicate better than I am right now, right? Now, and also remember, I talk about this all the time. Individuals with autism, just because of the symptoms of autism, like not being able to manage sensory input as well as others, not being able to understand language, all of those things lead to anxiety as well, right? So individuals with autism tend to have higher levels of anxiety to begin with. And that's very easy to understand as well. Imagine if you can't understand a language. Imagine if every light and sound and everything in your environment is overwhelming. You're going to have heightened anxiety. Now, the thing about PDA is that people correspond it to anxiety. And they say that individuals with PDA, the cause of their demand avoidance is that they have heightened level of anxiety. Well, guess what? A large number of people with autism have heightened anxiety to begin with. And yes, they will try to avoid demands, and they will show that based on those things that we consider to be challenging. So it's not like it is, yes, it affects people. You know, there are a number of people who have demand avoidance, But this doesn't mean that we need to call it a new thing and then just leave them alone. They're never going to mature out of it. In fact, they're always going to learn that communicating by throwing a tantrum is going to get me what I want. Like, it's the exact opposite. So I want to get into all those questions because there's a lot of people having the misunderstanding that if you are given the profile PDA, we can't teach you anymore. We need to just let you be. And that, I think, is the crux of the matter here. And I hope everybody kind of like now understands what these two things are.
Yeah, it's a very, very important question from a parent that, Shannon, I think you're both going to enjoy listening to, from Johannesburg, South Africa. The mom says she has a child diagnosed with PDA and autism. The parent was advised by professionals to ensure a low demand environment and to reduce demands. As the child has too much anxiety, the demands are causing more behavior, and the demands should be reduced, because if his nervous system is given time to heal, in time, he will be able to tolerate more demands once his nervous system has had a chance to reset. What are your thoughts on this advice?
First of all, over time, the nervous system just being left alone won't heal. I don't even know what that means. That's like just something someone said. It has absolutely no truth. Just leaving someone alone, their nervous system is not going to change in any way. Anxiety. Let's talk about that for a minute, because we do talk a lot about how to, given that kids with autism have different behaviors, different symptoms, I always talk about find the root cause and try to deal with what the root cause is. So, for example, let's say there is a child who has a lot of anxiety. Why isn't anyone dealing with the anxiety? Why are we focused on everything else? Why is no one focused on the anxiety itself? So with this child, it's not even about, yes, I would start with low demands, but I would most definitely increase the demands over time. And as I'm doing that, I would try to find out what is causing anxiety and how can I deal with the anxiety? Because otherwise, the anxiety is going to gradually control this individual's life forever, as it is beginning to right now. I'm not denying by any means, Ilana, that some kids do have anxiety, and as a result of the anxiety, they might want to avoid situations that cause them additional anxiety, okay? But I don't agree that all demands cause additional anxiety. There's a big difference. For example, if a child is going to be going to school for the first time and they throw a massive tantrum, I would say that's probably because of anxiety, because it's a new environment. They don't know how they're going to be dealt with. They don't know anyone there, et cetera, right? They're going into an anxiety-provoking situation. But if a child refuses to put on their shoes, I don't think that has anything to do with anxiety. I think that simply has to do with the fact that they have learned that I don't have to do things when I tantrum. I don't want to do them. I won't do them. So there's a difference between things where the child is just communicating defiance or demand avoidance in a challenging way. And if you let go of that, if you allow them to continue communicating that way, then that form of communication will increase. It's not going to decrease. There's not going to be a healing of the nervous system over time. They're just going to learn this is very effective communication. I can tantrum every time I don't want to do something, right? But if it's a child who's experiencing anxiety, we have to help them with the anxiety. And we still have to gradually teach them to do that thing that they're avoiding. You don't just let it go, right? Think of any other child. Forget about, again, the diagnosis of autism. I always try to go to just any other child. Imagine if your child woke up every morning, no diagnosis of autism, and just said, I don't want to go to school. I'm done. I'm not going. I have a lot of anxiety about this. I don't know anyone. I don't know how to use the bathroom. I don't have any friends. I don't like the teacher. I don't want to go. What would you do? Is any parent going to then say, okay, I think my child maybe has pathological demand avoidance. I think I should just let them stay home? No. Why not? Why don't we let our kids just make decisions at that time? Why not? Because their larger good, the long-term good for them is to overcome that obstacle, go to school, make friends, learn, and join society. So if we want the same things for our kids who are diagnosed with autism, then we have to do the same thing, which is we'll go slower for sure. We'll take it easier. We'll shape the behavior. We'll make sure we understand what's causing you anxiety. Is it a bad teacher? Do I need to go in and make school more friendly? Do I send an aide with you? Do I find a friend who can accompany you? Do I give you your favorite stuffed animal to take? There's a million things you can do to reduce the anxiety. Maybe we'll just go to the parking lot today and try it tomorrow. But we will gradually get you through it. Because when you give up by saying it's PDA, you're giving up on your child's ability. That's what you're doing. You're just putting a profile on it and saying he can't do it. And I just don't buy that. I think every child with autism can actually get over their anxiety. And I strongly believe they can learn. And that's the difference.
Another parent in South Africa asks, my PDA coach has suggested that I give my son autonomy to decide when to, for example, stop playing the PlayStation. I should not put a time limit on him to end his games, but rather ask him how much more time he needs and let him have autonomy in all decision making, as he has a PDA and autism diagnosis.
Right. And I guess, you have to take those situations and just actually apply them to real life. Right. So in other words, can you, if you really believe that you need to give the individual autonomy in all of their choices, then can you also allow that individual to not go to the toilet when they just use any location they want to have a bowel movement or not get dressed, go out and just do whatever they want to do, not go to school, throw things around the house. So when do you actually stop the autonomy? You know what I mean? What becomes, oh no, this playing a game, you could say, oh, I'm just going to let my child sit there and play a game for 12 hours, which in itself is problematic, right? But it's not as problematic as truly if you're going to give them autonomy. What if your child says, I don't want to wear clothes? Where does it end? This is the question I ask parents, right? Because it's not realistic to say, I want to give them full autonomy. It's just not possible. In life, in civilized society, we all learn rules. We do, right? One of the rules is you got to get dressed. It's just that is a rule. For children, one rule is you actually have to go to school or have homeschooling or something like that, right? Another rule is, if you want to be part of society, you cannot hit others. Is that not a rule? That's a rule, correct? So which one of these rules do we want to give autonomy and which ones do we not? I think that's where it starts, and that's what you have to wrap your head around as a parent, because remember, this is, I think, again, I always talk about this because as someone who's been diagnosing for a really long time, things that are in the diagnostic manual classified as a disorder are things that are defined by they are so severe and disturbing that they remove you, they make it impossible for you to survive in society. That's a given on every disorder. Every disorder is not a disorder unless it actually takes away from your ability to function in your social and home settings. Okay. So do you want your child to function in society, or would you like to allow them to stay at home and do whatever they want to do? That's the real question. What's your goal? And it's very, very hard as a parent. I totally understand that. And what's further difficult, I think, is the fact that people on the PDA kind of support side say you need to give choices. And actually, I agree with that, because in ABA, like, let's just talk about how good ABA would handle, and I don't want to say someone with PDA because it's not a diagnosis, but someone who has anxiety. I'll say that, right? Someone who has autism and has anxiety and avoids demands. Okay, fair enough. That's the closest I'm going to say to the PDA profile. They have anxiety and they avoid demands. How would ABA handle that? So some of the ways that someone in ABA would handle that is they would, first of all, focus on the cause of the anxiety. How can I make the environment easier for this individual? How can I do antecedent control where I can give this individual as many things as I can to make them feel less anxious, right? Number one. Number two, how can I make the demands tiny to begin with and huge amounts of reinforcers in the beginning, and gradually, very, very, very gradually increase the demand so the individual doesn't react, and keep the reinforcers really high for a really long time, right? Anyone who has a anxiety fear of something is going to respond to that, because it's like taking baby steps, right? Like, you do just a tiny bit, I'm going to give you a huge amount. Another way I can deal with it is I can give them some choices. And this is a really good example, because you guys both, as moms who've done a lot of ABA, do you remember when you start let's say a PECS board or something where you're giving your child choices? The first lesson is don't put a choice on there that they cannot have. Remember, you only put choices that are available, that are really able to be given. So this is where it differs, right? You can give your child choices, but make sure you don't give them choices that are anti-society, like the choice of playing on your game for 10 hours. That's not a choice. The choice could be you can play this for 1 hour and then get this huge reinforcer, or you can do something else. You know what I mean? So choices are good, but the choices have limits around them as well. They're not just full autonomy. So there's lots of things that we do in ABA. It's funny because really this PDA is escape motivated behavior. It's an escape function, right? It's demand avoidance. That's all it is. That is all it is. And it's one of the 4 functions that we talk about. So this is nothing new. And to say, I read one of the questions, I think Ilana had I think from a behavior analyst, had said something like, this doesn't even look like ABA anymore. And I agree. When you know that the function of a behavior is to escape a demand, in other words, the reason you're doing a behavior is in order to get out of a demand, your job as a behavior analyst is to find ways to not allow that to happen, is to find ways, like the ways that I just listed, gradual shaping, lots of reinforcement, small prompts, all of that kind of stuff is done in order to teach the individual to actually adhere to the demand as opposed to avoid it. Because imagine if you avoided all demands in life. How would you progress? How would you live?
But I want to reiterate what you said before about it being fair, that we don't just do this without being fair, by lowering the demands in the environment, by taking baby steps, because that's important. And I feel like a lot of times people forget that aspect of it, that it's not just throwing people in the deep end.
There are lots of people in this world who have so much anxiety without a diagnosis of ASD, who have so much anxiety that they don't even leave their own homes. Okay, so there's lots of levels of anxiety. And my point in saying that with PDA or with anything else, we need to be looking at the anxiety. It's not just the anxiety I'm talking about, Shannon. This is kind of what I always talk about. The individual is a whole human being. You have to look at everything, not just their behavior. So you have to, yes, do they have a lot of anxiety? Do I deal with it differently? Do they have sensory input issues? They can't focus their eyes on one stimulus. Do you teach a child the same way if they can't focus their eyes? No, you modify everything you're doing. Do you teach a child who didn't sleep last night the same way? No, you modify everything you're doing. Do you teach a child who has gastrointestinal inflammation and has diarrhea all day long? No, you modify everything you're doing as a behaviorist. The whole point of it is to pay attention to everything about that human being, including their anxiety that's leading to this demand avoidance or anything else. They might have had trauma, which whatever it is, pay attention to the whole human being and help them. But your ultimate goal doesn't change. Your ultimate goal is never going to be leave them alone because their nervous system will heal in 10 years. That's not the goal. The goal is to teach them. The goal is to help them get better in whatever way they want. And I'm not saying that they're worse. I'm just saying get better at acquiring skills so that they can live a better life, like all of us, That's the whole point of it, right? And I think PDA, unfortunately, is something that just diverts our attention and gives us, I guess, as parents, the ability to just stop. And listen, the other side of this, which we haven't even really talked about, is that we're looking for things like this as parents because it's extremely traumatic to us as parents if we have to place demands on our children and watch them cry and tantrum and, have severe reactions. As a parent, we would rather be told, leave your child alone. It's okay. They have a diagnosis and you must leave them alone. We would rather be told that because then we don't have to deal with that tantrum at that moment. You know what I mean? So there's conditioning that's happening for us as well. You know this. I mean, Shannon, you and I have talked about this a lot where you remember when in the days when like you would get bitten or something, right?
Yes.
And you do whatever you can to avoid that. Because it's very traumatic. It's a punishment to you as the parent to provoke that. No, you don't want to provoke that. I'm not going to say anything. I'm not going to place any demand on my child if it's going to provoke a severe reaction. So that's the other side of it.
And when an expert is saying to you, oh, yeah, don't overload them, don't do demands, it becomes permission to fall into that. But as you said earlier, where does that end up?
Yeah, exactly.
And that's the scary thing for me. The example that I like to give parents all the time is that when our children are learning to walk, they fall and they hit their heads and they, and we put bumpers on the thing. We don't say, we're not doing this. Get them a wheelchair. We're stopping this because it's uncomfortable. But we don't do that because we know where it's going to end up. We know that eventually we're going to get to a better day and they're going to walk. And I think it's important for parents to hear that your child can have a great deal of anxiety and that you can do things to help them to get to the point where the anxiety is manageable for them and they're not being stopped. And your life and their life are not being stopped because of the anxiety.
Exactly.
I'm living through that. I'm somebody who has a great deal of anxiety.
Well, I love that. But I love the way you just said that because that's so important. We get so focused on should we be placing demands or should we not be placing demands? That's not even the discussion right now. The discussion is, how do I deal with the anxiety my child's having? And we're not focused on that. That's even has a term. It's called overshadowing. Autism is so big that it overshadows these other things. How many of these parents, Ilana, who come to you and say, I was told not to place any demands, how many of them have actually seen someone for medication for anxiety? How many of them have actually spoken to that psychologist about anxiety? Forget about everything else. How do I manage? What are some cognitive behavior techniques for anxiety? Have they been taught to meditate? Have they been taught breathing exercises? Have they been given antecedent modifications to deal with the thing that's provoking the anxiety? That's the question. And the differentiation of what is anxiety versus just demand avoidance. Because I saw some of the questions and they were things like, my child refuses to put his socks on or get dressed or whatever, that kind of stuff. I don't think that's anxiety. Like, let's be very clear there. There could be a sensory aspect to that. I'm not denying any of that, but we can't make anxiety also an excuse for everything too, right? It's important to actually recognize and respect, as the individual who wrote to Shannon right now, anxiety is powerful and it can really cause debilitating responses.
I always tell the parents, choose your hard. Choose your hard.
Yes.
It's hard not to place demands on your child, and then it's hard to place demands on your child. Choose your hard. Long term, which hard is going to give the best results? So choose
long term or short term. The example I always use is, because it's a common thing where parents will say he doesn't sleep, so I let him sleep with me. He'll sleep a lot better when he sleeps with me. And I will ask parents, I get it, and that's the short term answer. Are you willing to do that when he's 18? Because there has to be also a long term, right? There's a short term and a long term. So sometimes we take we choose the easier, as you said, we avoid the hard decisions, but then in the long term, they're harder even. So with ODD, it's kind of an interesting diagnosis. It's not one that I like very much, because as a behaviorist, I always just tend to look at function. And with ODD, it's one of those things where you have to ask yourself, how did this develop? Where did this begin, right? Because no one begins this way. Now, sometimes we talk about kids with autism, and we can say that, yeah, it starts because they have anxiety or because they have difficulty understanding, etc. But ODD is also something that has a root cause, and it's an issue of determining the root cause. Now, remember, you can also have some anxiety when you have oppositional defiant disorder. But aside from that, with children who are experiencing or expressing themselves through the symptoms of ODD, often it is a very long history of the child having received what they wanted by behaving this way. So this is, again, one of those things we talk about in ABA, is identify the function. And if you have a child who at the age of 3 learns that when they hit their sibling, they're going to get the toy they wanted, a very, very basic thing. And if you let it be, if you allow that, guess what will happen? At 5, they will hit their peers in school. At 7, they will push their teacher. At 9, they will argue with you. At 11, it just progresses, because the individual has learned that the more challenging I am, the more I will get my way. It's a very simple thing. So the sooner the individual learns that they cannot get what they want because of this type of behavior, and that they must communicate in a different way, the better it is. Because it's easier when they're 3 than when they're 13. We always say that, right? Now, when they're 13, it just becomes so incredibly difficult, because a lot of times we're talking about kids we're talking about two sides. We're talking about parents and individuals who are already now bruised and battered and afraid on the parent side. So they do give in more. And on the individual side, we're talking about someone who's had many, many years of communicating that way, and they just don't know any better. Like, this is the way that I communicate, right? And so now breaking that pattern, and you both know the number one thing that's going to happen is there's going to be a burst in behavior before the individual realizes that this is not effective anymore. And who can manage? It's very hard to manage a 13-year-old boy who's already aggressive or is already defiant in a lot of ways, right? That's why it is sometimes helpful, not always, sometimes helpful to have a combined kind of multidisciplinary type of intervention, which includes medication. Medication therapy, whether it's behavioral or cognitive behavioral, and that depends on the functioning level of the individual, that's the treatment of choice for ODD. It's the combination of those two. That's the treatment of choice. But again, I'm not big into labels when it comes to challenging behavior, right? Whether it's ODD, PDA, or whatever it is, because as a behaviorist, you're taught that all behavior has a function. And it's really all about identifying the function. So when this individual argues and by the way, as you both know, every behavior has to be looked at individually and not as a personality type. So it's like every instance, like you named a lot of different scenarios that this parent has written in about. Each one has to be analyzed separately, because one could be the child's getting attention for this. Another one could be the child's getting the tangible item they want. Another one could be they're avoiding a situation. Like each function has to be dealt with individually. And when we label it, that's why I don't like ODD either, even though it is a diagnosis. When you label it, it's a personality. Now it's like, oh, I can't ever deal with these issues. That's not true. You deal with one at a time, and you analyze as you know, and you find out what's causing it, what's the antecedent, what's the consequence, how do I change those? It's always that. It's always what's the function of this behavior. So, this individual who argues with teachers, let's say you want to approach that one. What are the things we can change so that he's not arguing with teachers? Well, we can make the demands easier, and we can withhold reinforcers and only give them when he doesn't argue. I mean, there's lots of behavioral manipulations, right, that are just not being considered. And it's hard. I'm not saying that's probably one of the hardest ones that we talked about today, because we're talking about a 13-year-old who has a pattern of behavior now. So it's very hard. And it starts with identifying their reinforcers and making sure they only get them when their behavior is not avoidance or demand avoidance or challenging.
Doreen was basically saying that we must always determine the function of the behaviors, and also determine the developmental skills deficits and teach those skills so that we can teach another way. And, It may be they're 13 years old and they've learned to behave in a certain way for a longer period of time, and maybe take a longer time to undo the learned behavior. But we have to focus on teaching them a better way to deal with demands.
Exactly.
So, I just feel that you cleared up so many misconceptions around both diagnoses, PDA and ODD today. I really do. It's been wonderful to hear you explain those two diagnoses.
Thank you. And PDA is not a diagnosis, but thank you.
Yeah, absolutely. Oh my goodness. Thank you for that clarification. And I think it's, again, very enlightening for us in South Africa to hear that it's not a diagnosis. This is big news, headlines.
It's just a profile that someone came up with. And we have lots of autism profiles, right? We have profiles of kids who are very sensory reactive. We have profiles of kids who are non-vocal. I mean, there's lots of different vocal. It's a whole syndrome, right? But we can't just make it into a diagnosis.
Can I say something about the rights of that 13-year-old? Because I think a lot of times we get upside down about this. Imagine being 13 years old with all the hormones that you have and not having a way of getting your needs met unless you throw a tantrum and argue with people. Imagine what that would feel like in your body, in your skin. If the only way you could come close to making it fair is by throwing a tantrum. Throw a tantrum today in your room. Go through a tantrum. It's a lot of energy, you guys. It's exhausting. And if I could get my needs met by finding an alternate way of communicating, my life would be better. Yeah. And so by giving in constantly and saying, well, it's just ODD and they're just defiant, and not really going to the heart of the problem, we're not doing that 13-year-old any favor.
Agreed.
Just wanted to say that.
Thank you for that, Shannon. And I also thank you, Ilana, for what you said, because I think it starts with a massive amount of support for this family. Like, this is a family who needs a lot of people there. If they're going to start intervention, you're going to need people there. Like, let's just be clear, because the first step of this intervention, obviously, is to only give reinforcers for positive behavior, right? That means you're withdrawing reinforcers when these challenging behaviors occur. that's when you need the support there. Because when you're looking at a 13-year-old, they could break things in the house. They could become violent. And so you need to have support there while the individual is learning the new rules, which are, I will only get reinforcers. I will only get access to the things I want if I don't have these challenging behaviors. And it's hard. It's a process.
Well, that 13-year-old is going to become 15 and 18 and 22.
That's right.
It's going to get worse, and they're going to get stronger, and the behaviors are going to get more, definitely not better.
Absolutely. Ladies, I cannot believe this, but we are out of time, and we only scratched the surface of the questions. My apologies to all of the families and the professionals that wrote in questions. Hopefully, the overarching topic answered some of the questions that you guys had.